What's up everyone, Dr. Beau here, and today I am answering your questions about pain behind the shoulder blade that goes down to your hand. Stay tuned.
How can I help you today?
All right, so the question of the day is, and by the way guys, if you have a question for me, you are more than welcome to ask below in the comments here or send me a message on Instagram at Dr.Beau. I usually pick 1 to 2 questions a day and I answer it here. I post it on all my social media and especially here on YouTube where most people will find it. So anyway, today's question is, hey Dr. Beau, I have been experiencing pain behind my left shoulder blade for the last week and now am noticing pain going down the outside of my left arm and wrapping around to the front of my chest. I went to the medical doctor who ran a whole bunch of tests thinking I may have had a heart attack, but it came up that there is nothing going on. They think it's some sort of muscle spasm. What do you think it is? Okay, this, guys, is a very, very common question that I see a ton of. And really, to be very blunt with it is a rib head issue. Now, a lot of the times people think about their ribs just being like the protective, basically outside barrier of, around the lungs, so to speak. But I have my model here, my spine here with me. So let me kind of explain really quickly. So this is the back view. This is the person looking forward. This is you looking to the side. Each of these guys are called vertebrae. These little guys on the outside here are called transverse processes. And I'm gonna try to zoom in here, right? And what you can kind of see is this portion right here is these little facet angles, these little joints that the rib heads that wrap around kind of sit in, kind of like little grooves, so to speak. Now, what I tell my patients, and this isn't exactly anatomically correct, but the rib as it wraps around and the transverse process, they kind of sit like this. Hence you see that little groove. And there's a capsule that goes around it that holds it in place. And every time that we breathe, it expands and contracts, just very little bits. However, if we reach and we pull or we pull back or we fall back on ourselves, sometimes those ribs will push up and stretch that capsule. We in chiropractic call that a rib subluxation. Now, it's not a rib dislocation. Dislocation means the rib would have literally popped out of joint, completely out of place. This is what happens is the rib is just moving a little bit, stretching the capsule a little bit. And when that happens, the surrounding musculature that sits right all around here, like your rhomboids, those guys go into a really deep spasm. And then that spasm travels out to the shoulder because the shoulder's a free moving, free floating articulation, excuse me, and those muscles become tight. And then as you guys know, the nerves that come out of your neck, they go down your arm, and if all of these muscles are tight, chances are you're gonna impede on some of those nerves, and you're gonna get some numbness and tingling going down the outside lateral portion of the arm, sometimes even down into the fingers, wraps around to the chest. Now, I always tell people, if you're experiencing this back pain and it wraps around, especially for the left side of your chest, you definitely want to get checked by your medical doctor because yes, heart attack is a very real thing. But in most cases, especially by the time they end up in my practice, this is rib subluxation. It really shows up with, people say, Beau, I feel like I have a quote unquote ball underneath my left shoulder blade or my shoulder blade. I'm getting outside arm pain going down the lateral aspect of the arm. What can I do about it? Now, there's 2 things you can do about it. First off, in my opinion, if you're experiencing this, you should go to a chiropractor. Why? Because we adjust these. I probably adjust like 8 or 10 of these a day in my practice. Super simple adjustment, big time relief. I mean, you get a big old adjustment, big movement if it's done correctly, and almost instantly the patient has a lot of relief. Second thing that you can do, I don't have one with me, but you can take a tennis ball and you can roll up and down on the sides of the spine here. And sometimes you can get those ribs to kind of actually move themselves a little bit back into place. Now, little caveat with this is if that rib is really out of alignment there, it's really subluxated, that capsule is really stretched, it takes about 72 hours for that capsule to tighten back down to its normal place. And during that period of time, the rib can kind of go in and out a little bit. So it's super susceptible to kind of going re-subluxating, I guess, if that's a word. So you want to use ice, you want to use some sort of topicals. Some people choose to use like Advil or Tylenol to decrease inflammation. I like products like Inflavanoid or our secret sauce, which goes over the top of it. But you want to try to take it easy. Don't do any like heavy lifting, gym workouts, nothing pushing, pulling, just for a couple of days. And usually we will see the radiating pain go away within about a day or so. And then I usually bring a patient back at least for a second adjustment to reassess it to make sure it's in the right place. But yes, guys, this is a very, very common thing that we see. It freaks people out because they think they're having a heart attack, and rightly so. You say, hey, left-sided chest pain going down your arm. Oh my God, is this it? Luckily, in most of the cases, it's not. It's just ribs that have gone out of alignment. So if you're experiencing pain behind your left shoulder blade, and chances are that's what's going on with it, get in with a chiropractor, have them check it. If you guys have questions about this, please let me know down in the comments. I'm always here for you guys. That's why I'm doing this. It's funny. When I was thinking about how I could help more people using, social media, using YouTube, I just thought, why don't I just answer your guys' questions? Because people ask me questions all the time. And they're like, that was a really good explanation. And I was like, okay, well, that sounds like something that I think other people would enjoy as well. So if you guys have questions, please ask, send me messages. That's what I'm here for. Hope you guys are having a good one. I'll talk to you.